Good day, Missoula County. Today is Thursday, June 11th. I'm Ken Parks, Acting Incident Commander for the Missoula County COVID-19 Response Team. This afternoon, I'm going to update you with current local and state case counts and review the county COVID-19 testing process from making an appointment to receiving test results. I'll also talk a little bit about the nuances of scientific testing to inform understanding of scientific testing accuracy in general and what that means for COVID-19 testing specifically. As of this morning, we've had a total of 41 cumulative positive cases to date in Missoula. 39 of those cases were identified by testing, and 2 of those cases were epi-linked. We have had 40 recoveries and 1 death. We have no active cases in isolation currently. The state has had a total of 563 cases, including 3 new cases confirmed this morning. New cases today are reported in Gallatin and Yellowstone counties, and the state is reporting 58 active cases across the whole state. Today, the county continues offering testing services for Missoula County residents currently experiencing known COVID symptoms and healthcare workers and first responders working in Missoula County that are currently experiencing known COVID symptoms. As mentioned in prior daily briefings, the county is in the process of expanding its testing criteria and determining what that will look like in Missoula County. We continue working with community partners to develop a plan that not only meets current local level needs, but also anticipates future local level needs. Recall that Missoula County is one of 20 high visitation communities in Montana as defined by the state. While these high visitation communities share that designation and will receive additional resources for community testing and contact tracing, broader testing will look different in different counties. We are already seeing this. This is because each county is tasked with determining the best way to use, implement, and evaluate the use of those additional resources at the local level. A different approach does not mean that one county is doing something better or worse than another. In fact, it is likely a very good thing that different counties are taking different approaches to best meet their local needs. If each county has an informed, tailored approach, that it increases the chances of best serving the greatest number of people with the resources available. Remember that resources is also a very comprehensive and is broader than funding alone. It also includes things like supplies and staff. Missoula County is unique in that, in addition to being a high visitation community, it is also more densely populated than other counties. It also serves as a healthcare hub for many people living outside of city and county limits and even outside of the state of Montana. Missoula County's healthcare hub is just one of several components that county leadership takes into consideration when developing and implementing a broader testing criteria. Our local level plan for broadening testing is in process, and progress remains steady due to our great collaborative partnerships across the county, as well as information gleaned from thoughtful communication with other counties with similar considerations like population size, healthcare infrastructure, and tourism considerations. We continue sharing information as it becomes available, and once we finalize the plan, we send it to the state for review and approval. After approval, we will be able to share more specific details with you and guide the community through the process of implementing the broader testing criteria. Before we expand our testing criteria in the coming weeks, I'd like to revisit our current ongoing testing processes so that you are familiar with these processes, as well as the science behind the process and the test. If you are someone that meets our current testing criteria, you can call 258-INFO Monday through Friday from 8 a.m. to 5 p.m. and speak with a nurse who will guide you through the next steps. Once you're on the phone with the nurse, they will ask you a handful of what we call screening questions to determine your symptoms, risk, and exposure. If it is determined that you meet current testing criteria, then you'll receive either a same-day or a next-day appointment, depending on our capacity. You'll also receive very specific instructions about the appointment, the process, and expected next steps. The county fairground site can safely accommodate drive-through testing by appointment only. This ensures that both community and personnel are as safe as they possibly can be from arriving at the appointment to leaving the testing site. Let's say you have an appointment and you are asked to arrive at 10 a.m. in a vehicle. Well, you stay in the vehicle for the entire process. Staff will greet you and verify your identity, much like you experience at the doctor's office. This ensures that you are the patient scheduled for that time. After verifying your identity, staff guide you to an educational station where you'll learn about isolation steps and why it's so important to remain in isolation until you receive negative results or you finish your 14-day quarantine. The next station is the testing station. Patients are given very specific instructions on how to complete a self-swab using a mid-turbinate swab on both nostrils with guidance and observation by a nurse. If a patient needs assistance, perhaps due to limited physical or cognitive abilities or young age, like a kiddo, a nurse, of course, will swab for you or assist you with the swabbing. Staff ensure that the specimen is carefully and safely put into a patient-labeled tube with a viral transport solution that protects the specimen until it is ready to be processed at the state lab. The specimen is placed in a transport bag with appropriate paperwork and refrigerated as quickly as possible. Samples are sent via courier to the state lab for processing. The state system updates as specimens are processed, and the Missoula County Health Department nurses follow up with patients regarding their results and next steps. Notification is private and confidential. Nurses only speak with the patient or whoever the patient has legally authorized to hear their personal medical information. The test kits used at the county are mid-turbinate swabs that are as sensitive as a standard nasopharyngeal swab. These test kits specifically look for RNA related to COVID-19. They do not look for anything related to any of the other coronaviruses or the flu. This means if you have COVID, it will likely find it. But if you have the flu, you will need to have a different test. Accurate test results are necessary to both develop meaningful care plans and flatten the curve, or keep it flat, as we are currently doing in Missoula County. That being said, any scientific test for any virus has its limitations. This is just the nature of the beast. The sensitivity of county COVID tests, or the likelihood that the test will pick up the COVID if it is there, is about 96%. This is incredible and very accurate, but it still leaves a margin of testing error at about 4%. This margin of error has nothing to do with any individual, but rather is directly related to the test itself. This means that if a test is perfectly collected, transported, and assessed, there is a 96% chance of correctly identifying COVID if it is present. And there's a 4% chance of the test not identifying COVID if it is present. The same is true when we look at a test sensitivity or the likelihood that the test correctly identifies that COVID is not there. Again, no known test exists for any known virus that is 100% accurate. This relates to the nature of scientific testing in general. I'm sharing all this information today to let you know what county testing currently looks like in our community. The information I shared captures the testing process for the county only, from making an appointment to swabbing to notifying results. Testing processes and criteria are different at different clinics. While we are in constant communication with our medical partners, each organization operates slightly differently to best address their needs while working within the structures of their own organizations. For example, while the county exclusively sends specimens to the state lab, other providers might have other lab contacts or contractual agreements in place. Well, we look forward to continuing to serve Missoula County in the best way possible with the information and the resources that we have available. Please continue with those safety practices, and please continue taking care of each other. Kindness and compassion and understanding can go a long way. Thank you.